Attempting to complete a homework assignment or project for a class, do you find yourself sidetracking repeatedly? Perhaps you'll Google keywords relevant to the topic you're researching, only to find yourself with 15 tabs open. Several of them are irrelevant to your topic, with music coming from somewhere. Every single time you attempt to refocus, you find yourself in the same maddening cycle over and over every 5 minutes of just distraction. If so, you've got poor self-control. Or maybe you just have ADHD. It's hard to tell when a person has ADHD. The diagnosis of this disorder takes time and requires an evaluation by typically a psychiatrist. This will often result in a prescription for stimulants such as Adderall, Ritalin, or Concerta, or however, maybe you've already come across these drugs. Perhaps you have a friend or connection who's willing to part ways with an Addy or an upper for a few dollars, hyping you up about how it'll help you stay awake and focused. This isn't uncommon, as an analytical study performed by Benson and others for Clinical Child and Family Psychology Review estimated that the rate of stimulant medication misuse amongst college students is about 17%. However, prescription stimulants meant to aid ADHD cognitive symptoms don't affect those without ADHD in the same ways. They also impact emotional functions and cause various bodily side effects in those with and without ADHD. The purpose of prescription stimulants is to give the brains of those with ADHD a boost. It helps the background noise of distractions in their head calm down while giving them motivation through increases in norepinephrine and dopamine, neurotransmitters that are part of our brain's reward system, and help with motivation. This is definitely going to be important later. But how can we measure the effect of these stimulants? A study published by Shaheen E. Lakian in the peer-reviewed journal Brain and Behavior found some interesting results. In adults with ADHD, treated ADHD subjects had significantly better scores on measures of IQ than did untreated patients. In children with ADHD, it's been well established that prescription stimulants enhance classroom manageability of those afflicted due to increases in attention and academic productivity. Overall, with adults and children, on a neurocognitive screening, significant differences were detected between normal and untreated ADHD patients. Treated patients performed better than untreated patients. But what happens when someone without ADHD takes a prescription stimulant? Those are all instances where someone had ADHD. But if they don't, well, it was found that in the same study, there were more interesting finds. Firstly, they found that reports of being high and feeling stimulated were subjective and produced solely by expecting to receive methylphenidate, a type of stimulant medication. Second, where there were any enhancements, the degree to which those enhancements existed depended entirely upon the baseline performance of the individuals. So they measured them before the screening and then while they were on the medication. Lower performing individuals on the pre-screening were more enhanced than already higher performers. So what does that mean? The drugs don't offer much help to people with greater intellectual abilities. So overall, for those without ADHD, the evidence is actually quite mixed. There are some findings of enhancements and some findings of null results. The small enhancements that did result were evident in subjects who had low cognitive performance to start with, like we mentioned, showing that the drug is more effective at correcting deficits than enhancing performance. This is the important information to take away here. Moving on to the second point, it was mentioned that prescription stimulants also affect emotional functions. According to an article published by Rachel Horsting via the Yale School of Medicine, a team at Yale analyzed 32 studies and compared the side effects of two different classes of ADHD medication. The first class included methylphenidates, and the second class included amphetamine derivatives. The team found that amphetamine-derived medications were associated with an increase in irritability. Methylphenidates were not. This means that Adderall, the very common and popular study drug, which is also an amphetamine derivative, actually has the potential to cause irritability. Furthermore, according to research completed by Ipek, Suzer, Gamley, and others, published in the Journal of Neuropsychiatric Disease and Treatment, found that for those with ADHD, methylphenidates led to significant improvements in emotional dysregulation, possibly owing in part to a decrease in impulsivity, so that individuals felt more able to supervise their emotions and engage in goal-directed behaviors, basically focusing on the bigger picture. This shows an emotional benefit for those with ADHD who take methylphenidate-based stimulants. On the flip side, for those without ADHD, emotionally speaking, the National Institute of Health states that stimulants flood the brain with dopamine, which helps those with ADHD feel motivated. But in those without ADHD, this actually causes a dopamine overload. So instead of having a calming effect and motivating, as it would for people with ADHD, stimulants taken without a medical reason can actually disrupt brain communication and cause euphoria. And while this may sound enticing to some, there are other side effects to consider, which will be discussed next. So prescription stimulants have many varying side effects. Aside from emotional side effects, they can also have other bodily side effects, and of course these are case by case for everyone. According to an article published on healthline.com, medically reviewed by Timothy J. Legg, PhD, CRNP, side effects of Adderall usage, both in those with and without ADHD diagnoses, can include impacts to the central nervous system, which can include nervousness, headaches, and dizziness. Also impacts to the circulatory and respiratory systems, which can include increased blood pressure and heart rate, as well as circulation issues, where you might experience some numbness and or pain in your fingers or toes. Some of the more serious circulatory side effects can include cardiac arrest and stroke, which is pretty extreme. Lastly, impacts to the digestive system can include stomach pain, nausea, and vomiting. So while it may be enticing to drop $5 to $7 on a single pill to enhance focus for a day of studying, there's not much of a benefit to using stimulants unless you yourself suffer from ADHD. The cognitive performance enhancements are minimal, if any, and you're more likely to experience increased heart rate and anxiety than the calming, focused effect that stimulants offer to those with ADHD. Not to mention, you run the risk of experiencing unpleasant emotional and bodily side effects that could potentially become serious. This isn't to say that your 15 browser tabs are simply a result of poor self-control. The internet is full of distractions: social media, streamed content, Netflix, YouTube, instant messaging, Facebook, Instagram. So it's easy for anyone to be drawn into other more interesting things that don't include extensive research or focus for homework and classes that maybe you're just not interested in. However, if you find yourself struggling to focus on a daily basis, perhaps it truly is ADHD. Either way, it's important to understand the differences that those stimulants can have on those with and without ADHD. For those without ADHD, maybe it's safer to stick to coffee. After all, it's much tastier.